What's your part here today?
Look, I'm really honoured to be here and sharing in what is a really important discussion. I guess I come with a national lens and an understanding perhaps of some of the overarching policies that do impact greatly on rural communities. I'm particularly keen to talk about generalism, and to talk about place-based education and to talk about equity.
And I guess like a big one is staff shortages. I mean, from your experiences, what do places in Victoria need to do to help fix that?
I think it's a really complex problem, so I'm not going to tell you that there's one single solution because I wouldn't be being fair. Rural communities do understand that getting health professionals and getting professionals of many kinds to their communities is a complex and a difficult arrangement, and we do need to move with the times and understand that some of those services will be delivered face-to-face and some of them will be delivered in other ways. What we've got to do is look at what sustains in our workforces, and what we really need is that trusted band of health professionals who need to do the hands-on in our communities, supported by a legion of other health professionals in other areas. And some of those are in a hub and spoke type of arrangements, and some of those are even tertiary.
It's harder to get people into region. So is there focus of keeping residents local and educating them so they can stay in their local community?
That is absolutely one of my passions, is what I call place-based education. And I think we should be doing a number of different things to enhance the capacity of people to study and stay locally. That will mean that we need to change our educational institutions and their way of working so that we privilege place where people are. But in these days of online learning and the capacity for supervision, both locally and remotely, and the capacity to assess, it is very reasonable to think that many of our health courses can be delivered in quite small communities.